So my project's title is called Making the Connections to Improve the Environmental Sustainability at a Hospital. And like Fran was saying, that has been Ysbyty Gwynedd. And, you know, we do feel like it is our hospital. Before I go into my presentation, I just want to say, first of all, how it's been a privilege to be a Bevan Exemplar. And really, it's just completely pushed me outside of my comfort zone. And I've sort of, what we've achieved in the year sort of beyond what my expectations at the start of starting as a foundation year 1 doctor in Ysbyty Gwynedd. So just to give a bit of background and context to that, so I started my first job as an F1 in 2019 in August, and I was a bit of a eco-anxious medical student and also a foundation doctor when I just started work. The context of this is that 10 years, this is 10 years before I started work, the Lancet made a statement that climate change is the biggest global health threat of this century. And 4 years earlier, there was a new field which had been launched, which is called planetary health, and that gained global recognition that our health is interdependent to that of our environment, and was providing the evidence that underpins that. And the year that I started at Ysbyty Gwynedd, it was also the year the Health Board had the greatest carbon emissions of any of the health boards across Wales, and there wasn't any reduction in emissions from the previous years. And so the week I was applying for my Exemplar project, there was also a report that was released from Healthcare Without Harm, and it was on the global healthcare carbon footprint. And the key finding that they made, the statement, was that if the global healthcare sector was a country, it would be the 5th biggest emitter of greenhouse gases. So just a few months prior to that, I'd just taken an oath to do no harm, and I was a bit concerned starting work that if we weren't to see some changes, that I wouldn't be able to keep my oath to do no harm and be able to protect my future patients. So it was unsurprising, really, that the other junior doctors shared these concerns which I had. And this is us at the first global climate strike. We were showing our support for the Fridays for Future movement to limit global temperature rise to 1.5 degrees, which is really important to maintain people's health. So what I wanted to do was connect with the people who were already working on environmental sustainability. I wasn't an expert. I was a foundation year 1 doctor, and there were other people who were already working on this. We had an environmental officer. We had other people keen in the hospital. So I wanted to learn from their good practice, bring them together, and try and create a shared platform where we could transform our clinical practice and to be more smart and more climate smart. So this is us at Ysbyty Gwynedd Green Group at our 3rd meeting, and I feel like as a group we've got shared values. One of those is leading by example, to try and reduce our own environmental impact from our practice, and also to look to learn more and educate ourselves and our peers about climate change. And we also hope to act as a platform for our peers and to raise the voice of everybody, so that nobody within the hospital is too small to make a difference. So this focus on making connections wasn't just within the hospital. I was also focusing on making connections with other people across Wales, across the UK, and across Europe and the world, who already were doing good practice on climate change and health and sustainable healthcare. So we then developed our own unique place within the global movement for climate smart, sustainable and prudent healthcare. It's not only then putting some of my colleagues' work on the map, but also giving us a home where we can also be inspired by others and learn from their good practice. So these are a few of the groups that we've connected with for collaboration and inspiration. And these are some of our principles that we have to try and keep our focus and to keep a bit of a vision for what we want to achieve. these are mostly inspired by the Bevan Commission's prudent principles, but some are inspired by some of those other groups that we've connected with. One I want to highlight is justice, which fits in with the Bevan Commission's caring for those with the greatest health need first. And I think that climate change, it affects some of the most vulnerable groups and some of those who have contributed the least. So that I wanted to highlight that one, but there's also other areas which such as leadership, resilience, regeneration, collaboration and mitigation, which are all important areas to focus on. So where can we start to take action? And this is what people will always ask me, and I always try to point them in one of these three directions, each of which is mutually reinforcing and helps with the other areas. So you could start off by trying to learn more. You can try and connect with other people, or you can try and transform and focus on specific projects. So I'll just go into some of these areas in a bit more detail and what we've achieved in some of these areas. So in terms of connecting, across the hospital, we've had 82 people engaged as Green Group members, mostly at Ysbyty Gwynedd, but we've had some people from Glenclwyd. We've had people from all aspects of the hospital, from nurses, pharmacists, doctors, people in estates, environmental officers, infection control, health and safety, surgeons, anaesthetists, dietitians, geriatricians, art therapists. So pretty much anybody and everybody in the hospital, it seemed to be something that they cared about and was something that they wanted to take action on. So to engage staff more, we had a staff engagement stall to start the conversation, and we've gained many ideas from all of our colleagues, and we've been sharing newsletters with them via our mailing list. Another important aspect of connecting is also advocacy and campaigns, and we ended up during the pandemic joining over 40 million healthcare professionals all over the world, calling on our leaders to prioritise a healthy recovery. We also then went on to co-sign a letter to our First Minister, and then Yasmina, who you can see here, she's our communication and engagement lead. She was on S4C and BBC Wales, and this is her in an article that was published in BBC Wales titled "Climate Change: Bigger Threat Than COVID-19." And we're also in the local press, and I was writing some opinion pieces for the Bevan Commission. We are also able to, during this time as health professionals on the front line, able to use this time to think about a reset and thinking forward about the priorities that we want to think. And we were able to help input into the Build Back Better campaign as well. So also by connecting with people, we created a platform. So now clinical staff represented our health board's environmental steering group. Some of our ideas have been able to input into the overall decarbonisation strategy for NHS Wales. And we've acted as a case study for NHS England's Greener NHS, and we've been featured in the NHS Sustainability Impact Report. I think most of all, though, from connecting, we've created a community by connecting with other people. So, for example, all of the F1s at Ysbyty Gwynedd are stayed for their F2 posts, including myself. I'm not sure if we can take credit for that, but I think that's just one of those things of having a community at the hospital, which is really important. So one other area that you can focus on is learning. So what we've been doing in terms of this area, we've been teaching our colleagues, and we've had members presenting in their own departments on greening anaesthetic gases, on greening inhalers. I did a grand round on climate change and health. We've had journal clubs on the Lancet countdown, and we've created a shared resource of online resources that any of our members can access and use. And we've also recently created a calendar of global climate and health so that people can keep track of them. So there's loads of events happening all the time that people can join and be part of. So I think now probably one of the most interesting bit for a lot of people is okay, so where are we going to start doing some specific areas of action and specific projects? What I like to say to people is that they can do specific projects in their own specialty or in their own quality improvement projects, and look at sustainability as a key measure of quality for their quality improvement. And the Centre for Sustainable Healthcare has some really good resources for people that want to do that. But in terms of mitigation and decarbonisation, as a group, we identified 4 key areas that we wanted to focus on. So one of those was waste, which is a really visible issue that we see in the hospitals day to day, and has only got worse during the pandemic. We know from NHS England that they've used 900 million masks during the pandemic, and in the first 6 months of the pandemic, the carbon impact of the PPE was equivalent to flying from London to New York 65,500 times. So we're the first hospital in Wales to take part in a usable face mask pilot. And we think this will have significant financial benefits. Of course, have environmental benefits, but some health benefits, because some people that we've noticed have been struggling to tolerate some of the standard surgical face masks, and some of these masks can be used in clinical settings. And then another area of food. One working group has been set up working on sustainable food, and their aim is to help local growers apply for hospital procurement contracts. So that will help reduce travel miles, it will help the local economy, and also provide healthy and nutritious meals for patients and staff in the hospital. Transport is another big area that we think is really important to focus on. We've been walking and cycling to work and promoting this amongst our colleagues and trying to make it more accessible. So in terms of NHS Wales carbon footprint, 17% is transport, of which 2/3 of that is staff travel. So again, there's not only individual financial savings from taking your bike or walking to work, but there's also health benefits of getting some exercise. And of course, again, there's environmental benefits to that as well. Energy is another area that we need to focus on more to try and reduce the amount of energy that we're consuming, as well as move to renewable energy sources. And something that we need to work more with our estates department to try and achieve. One other really, really important area that has come up, particularly during the pandemic, was focusing on well-being, regeneration and biodiversity and nature connection. And I think this is an area that we've all noticed has been even more important during the pandemic and during lockdown, is the importance of getting out and outside and spending some time in nature. So along these lines, we've developed a meadow plan with magnificent meadows, and we've been donated 80 trees for the hospital, and some of our members were doing some guerrilla gardening during lockdown and growing vegetables in the hospital site. So thinking about the next steps. So I think, we have achieved like more than what I thought would be possible this year, but there's still so much work that needs to be done. And I know that some of my friends who've been working on this have been saying that globally, the healthcare sector's in atrial fibrillation on climate change and health, and it's trying to think about how to create some good cardiac output or get us back into sinus rhythm. So I think that maybe that was the case in Ysbyty Gwynedd. There was lots of people doing individual actions, but what we were able to do was bring them together and try and create a bit more of a cardiac output. One of my main worries is that if we were in a bit of atrial fibrillation here in Ysbyty Gwynedd, probably a lot of the other hospitals across Wales are. And I think, what does that mean for us across Wales? So I think it's trying to think, how can we have a more coordinated response across Wales, and how could we support other people to adopt green groups, I think is really important, and create a network across Wales. As part of that, I think it's really important that planetary health could be integrated into undergraduate and postgraduate curriculums across Wales. For us in Ysbyty Gwynedd, we're really keen to join the global Green and Healthy Hospital network of 36,000 green and healthy hospital and health centres. Try and identify green champions in each of our departments, and we ideally want to try and engage more people to be active members of the Green Group. Ideally, we'd want to engage about 550 staff across Betsy Quadrolada, which would be 3.5% of the staff, and hopefully that would change the culture, and that will be helpful in making sustainable healthcare and climate smart healthcare the norm. So I think it's really important to not understate how important this is, and I think that our leaders need to step up and make a statement of how how we are in a climate emergency, and how actually that is also a health emergency. And then the NHS decarbonisation strategy should be released in the beginning of next year. So I think we all need to pledge to protect planetary health and see how we can integrate sustainability into our daily lives and into any of our ongoing projects or what we're looking to do as we go forward. So one other thing that I wanted to say was that we don't necessarily need to have buy-in from our chief executives in our hospital to start green groups. Starting a green group is something that anybody can do, and I think if our CEO or hospital porter were to join our green group, we wouldn't treat them differently, because everybody has a really important role to play. So from my perspective, I don't think I've been particularly innovative other than bringing people together. But it's the individuals that we have within our hospitals who can be really innovative. So my hope is that by bringing people together, that we can begin to create some sort of sinus rhythm, which then can get us towards climate smart, sustainable and prudent healthcare. Ultimately, I think the aim would be not to need green groups, that this would be the norm across all of our hospitals in Wales, so that we can achieve, protect the well-being of future generations and achieve a healthier Wales. Thank you. And then here's just a few quotes from people in our green group.